and welcome to Talk About It Tuesday. I'm your host, Keith Taylor, and I'm here with Dr. Helou.
Hi.
And today we're talking about National HIV and Aging Awareness Day, which is September the 18th. So, Dr. Helou, how many older patients do you have that would be in that bracket of aging with HIV and AIDS?
So as you know, the HIV epidemic, started in the 80s, and it's been almost 40 years. So, the patients who are lucky enough to survive over those years are, hitting their 50s, 60s, 70s, and we consider people who are aging with HIV to be over 50 years old. So I would say that over 50% of our clients here at Staywell are older adults.
Oh, okay. So, what are the concerns for them that you may have in their aging process?
So definitely somebody who's living with HIV, there are studies that demonstrate that these patients have accelerated aging, so they can have more pronounced cardiovascular disease, they can have a heart attack or a stroke at a younger age because of the inflammation, especially if they don't take their medications consistently and they don't maintain an undetectable viral load. Also, if they have AIDS, their T cells are low, so those are all risk factors. These patients can also have cancer at a younger age, so it's very important to screen women for breast cancer with their mammograms and their pap smears every year, and to screen men also for lung cancer, prostate cancer, and other types of cancer.
Okay, yeah. So, does family medical history have anything to do with aging with HIV? Like, 'cause
Definitely.
you just mentioned some things that people that maybe not be HIV positive also go through too, with high blood pressure, diabetes. So, what are the things that people that are HIV positive that may have that medical history, what they should be looking out for?
So we should definitely look out for common things that we see in HIV negative patients, like screening for high blood pressure, for diabetes, for high cholesterol, and metabolic disease, which is more common and more prevalent with HIV.
Okay.
And some of the medications can also predispose to weight gain and high cholesterol, so it's very important to select the right and appropriate medication. It's very important for the patients to come see their doctor on a regular basis, every 3 to 6 months, have their blood work. Besides checking for their viral load and their CD4 count, it's definitely important to check, also for STDs, but also for cholesterol,
Right.
for diabetes, for kidney and liver function, to screen for all these illnesses and comorbidities that we mentioned.
Okay, yeah. So, what about how does mental health come into play with people that are aging with HIV?
So definitely, when somebody is over 50 or 60 years old, we have to start screening for certain conditions. Some of them can be genetic, some can be, contributed by their environment or their social situation. Some patients with HIV, definitely, if they're not consistent with taking their medications, can have like early onset of cognitive impairment or dementia, and it's important to identify like reversible sources if somebody has syphilis or Lyme disease or other issues that could be associated with their diagnosis, and do their blood work and complete a behavioral health assessment with myself, and also a referral through the behavioral health department with the social workers, the counselors, and the psychiatrists, and be on the appropriate medication for these conditions.
Right. Okay. So, wow, you give us a lot.
It is a lot. I mean,
Yes.
these patients are often struggling with depression, anxiety,
Yes.
which are common comorbidities in patients who have HIV, maybe, have also substance use disorder with heroin or
Right.
cocaine, or also other drugs. And we can offer support services here
Yeah.
for counseling, for IOP. So definitely seek out our help, and
Yeah.
learn about all the resources that are available to you.
Exactly. So with aging with HIV, because I'm actually Asian, I'm in that bracket. I'm 52. So, but I don't feel anything about my body that outside of what I should be expecting with the HIV diagnosis. You know what I mean? Like I don't feel. Now I do feel neuropathy
Mm.
every now and then in my
So
feet.
that's common, especially
Right.
with the older medications maybe that were prescribed.
Mm-hmm.
You know, you're taking your medication, so you're doing what you're supposed to do, and you're maintaining undetectable viral load.
Yes.
So definitely, as you continue to age, we want you to age successfully and be healthy, and continue to remain undetectable, and live a normal and healthy life.
That sounds good to me. So if you too are aging with HIV and AIDS, our doctor here he's one of the best and he will give you all the tools you need to make sure that you're having a successful aging with HIV and AIDS. So thank you very much for joining us and we will see you next week on Talk About It Tuesday. Have a good day.